So I'm a board certified psychiatrist and I've helped over 160 PMHNPs increase their clinical confidence with diagnosis, treatment, and getting rid of imposter syndrome and treating their psychiatric patients. So in this video, we're going to be covering the top 5 meds that I recommend new PMHNPs learn to master. And these 5 will be some of the most versatile medications that you can use in your practice. So let's start into it. So number 5 is Hydroxyzine, aka Vistaril or Atarax. And this one, its primary use is PRN anxiety. So a lot of people will say that, okay, I'm struggling with anxiety or I'm taking an SSRI, but I don't really notice the benefit yet. This is where hydroxyzine can really come in because it's given as a PRN. But what you have to balance is the sedation aspect of it. So I'll write PRN anxiety versus sedation. So this has multiple uses. This can be given for anxiety at night or during the day. Patients can take it. If they have anxiety at night, it's a great option because then it makes them sleepy as well. And what you're trying to do is you're trying to balance out the doses for it. So usually 25 to 50 milligrams is the sweet spot. So it comes in a capsule form, but the Atarax one, it also comes in a tablet, so it could even be split. But basically, you can give this as PRN. That's the most important use of it. You can give it daily as well too. So I've had patients take it as daily, but it's one that you can really start implementing into your regimen, especially to avoid benzo use. I'm not saying that you should avoid benzo use, but you can use it to help avoid. So try first. So try the hydroxyzine first. So number 4 is Lamotrigine or Lamictal. This is a really underrated medication, but it has a lot of benefits, especially for treatment-resistant depression and bipolar depression. So the benefit of this, it's a mood stabilizer, but it can be used for both of these things because it can also be used as adjunct. Because it doesn't work on the serotonin system, it works more with sodium channels. It can be stacked on to SSRIs, antipsychotics, benzos. Pretty much you can add it on to anything else. So that's why it's a key option in your toolkit to use. And then side effects, so tend to be decreased overall. So people tend to tolerate this medication way better. But the things to watch out for are SJS risk, right? So Stevens-Johnson syndrome risk. So you should watch out for that, right? That's what makes it risky. And so that's why you have to do a slow titration. So you have to master the patients that comes with the slow titration and working them up from 25 milligrams 25 milligrams for 2 weeks, then 50 milligrams and 100 milligrams, possibly 200 milligrams. So doing that, the SJS, as well as the slow titration, those are the 2 things that you got to really be mindful of with it and master with Lamictal. So number 3 is Bupropion or Wellbutrin. Now with this medication, Bupropion and Wellbutrin, it's also used for treatment-resistant depression, used as adjunct, used for ADHD. All of these things it will help for. Even bipolar depression with olanzapine, with any kind of mood stabilizer too. You can pair it with that. So understanding bupropion is super important. You have to understand that it's stimulating, so it's different. So that's why. So the reason it can be used as an adjunct is because it does norepinephrine and dopamine activity, not serotonin. And you also need to be mindful of things like seizures. That's the biggest risk. But the benefit and the stimulation, so insomnia, So the norepinephrine dopamine, that's what causes the increased seizure risk, the insomnia risk, right? The stimulation. But that benefit can help with ADHD, and that benefit can help with treatment-resistant depression. So knowing how to utilize this medication in your toolkit is very important. Mainly, you're just going to be using the XL formulation of this med, but there is the standard release or the sustained release and the IR that you can use. But by and large, your XL is going to be the one that you use. So number two is Sertraline or Zoloft. And the reason I picked this one is because this is a very heavy hitter, like standard SSRI, but it's different than Lexapro. So Lexapro tends to have less overall side effects. It tends to be less well tolerated, but anecdotally, it's a little bit like quote unquote weaker. Zoloft tends to be very strong. So this is a workhorse. This is a workhorse SSRI, but it can have side effects. Nausea is very common with this one. That's the biggest one. So other GI side effects, weight gain. And it's got a wide dosage range from 25 all the way to 200. Even higher, like 250 you can go to for OCD. And even here you could go to like 12.5 for extra sensitive patients. But this by and large is going to be your main dosage range. But that's why I say Zoloft, because it has a wide variety of dosing to work with. It's not like Lexapro, which is like 5, 10, 15, 20. This has a huge range. The side effect risk burden tends to be a little greater, and it tends to be stronger. But it's a really good workhorse, and it's a favorite of a lot of psychiatrists. So definitely important to be familiar with using this one. And number one, and one of my favorite meds, is Quetiapine or Seroquel. And the reason for this is because it has so many diverse uses. So it's used for bipolar, both mania and the depression. So it's used for insomnia, it's used for psychosis, it's used for agitation, delirium. So it just has so many uses that it has, even just for treatment-resistant depression. So it's used for that as well. So it's got so many uses that it's important to become very familiar with this medication, so that way you know how to maximize its efficacy. And so basically, it starts at 25 milligrams and and of course, psychosis, and goes up to like 1,200 milligrams. So huge doses, but typically around, let's say like 600, around, here's a benchmark, would be like 100, a benchmark would be 300, because different benchmarks target different things. So from here to here, you're targeting sleep. From about here to here, you're targeting mood. And then from here onward, you're targeting psychosis. And this is a gradient. It's not like, okay, you're at 400 milligrams, okay, now boom, you're targeting psychosis, or at 200, you're not targeting in sleep at all. But this is a gradient. But the point is that different patients will respond to different doses along this gradient. And there's a whole bunch of different options here too that you have. So it's not as easy to dose as, for example, risperidone, which is just 1 to 8 milligrams. So understanding the wide dosage range, and of course the side effects of metabolic. So understanding the metabolic side effects are very important too, because so you can manage and track them. But the nice thing about this is that there's decreased EPS. So it tends to be a lot better tolerated. So overall, if you're a new PMHNP or a new provider, these are the top 5 meds I recommend you start using in your practice, and understanding them, so that way they're very high yield too. So you can really start getting their benefits for your patients. And so if you want to learn more about psychiatric diagnosis, treatment, you want to get mentorship from me, a board certified psychiatrist, The best place to do that is in our PMHNP community. We've had over 160 students join so far, and so they're able to ask me questions. I'm able to guide them with their real cases, their actual cases. We do weekly Q&A calls, so I help them with the real world, true psychiatry, and I teach them basically how to become expert level providers so they can care more for their patients and be better recognized for their skills by the patients and as well as other colleagues and supervisors, so they can make more money too. So you can find that in our bio, but otherwise, yeah, I will see you in the next video.